Good afternoon, everybody. I'm Sayukta, your host for today's live from All About Skin Allergy Tea. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Urticaria is characterized by a round rash on the skin that itch intensely. It may be due to chemicals present in certain foods, allergy to certain medication, insect stings, sunlight, and sometimes the causes even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidence is higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can actually worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, kind of test required for its diagnosis, the right treatment and management approach for an early relief. So we have with us renowned dermatologist, Dr. Shikhhar Chaube, live from Mumbai. Dr. Shikhar Chaube is practicing dermatologist at ELIIXIR Skin and Hair Clinic and Santa Cruz, Mumbai. He will educate us more about urticaria and its management. Dr. Shikhar Chaube is a well-known dermatologist from Mumbai. He has completed his MBBS from Maharashtra University of Health Sciences, Nashik in 2014, certificate in medical cosmetology and aesthetics from Dr. Jamuna Institute for Medical and Aesthetic Cosmetology in 2019, and PGCON from Institute of Naval Medicine, INHS, Aswini in 2018. He has done his PG in dermatology and trichology from Colleges of Physicians and Surgeons, Mumbai. A very warm welcome to you, Dr. Chaube. Hope you are doing good, sir.
Very good afternoon. Hi, everybody.
So, doctor, we are going to talk about urticaria and its management. Now, the very first thing is, what is urticaria? How do we know that, how does it look like? What is urticaria actually?
Hi. So basically, when we're talking about urticaria, thank you for having me here. And I would just like to begin. Urticaria is basically characterized by a reddish, swollen skin rash, all right, which most people suffer from. Now, the difference from urticaria and other types of skin rashes is these don't permanently stay as a part of our skin. They sometimes erupt on different parts of the body. They can be available as wheals, as we commonly call them. They are reddish and erythematous in nature, more likely circular, arising from different parts of your body and technically any part. It starts from one particular region, say supposedly your forearm, and then it could extend to the rest of your body. Most people get scared with urticaria is because they spread very much on the body. They appear as reddish swellings, and sometimes are associated with swellings of the lips and the genitalia also, which can be a little bothersome.
Okay, so that's what urticaria is. What are the main causes responsible for urticaria?
Considering that it is an allergic condition, a lot of people suffer from urticaria because of the various dietary intake that they have in particular. Most likely to be nuts and dry fruits, ideally. If you see, there is a higher incidence of nut allergies in abroad. Yeah, and also in India, over the last 5 to 10 years, we've noticed that there has been a sudden uprise in the level of urticarial rise in India with nuts, specifically, dry fruits, peanuts, also dedicated options also, like, there are certain fruits and vegetables that have it. Brinjals, bottle gourd for that matter can also cause urticaria. Various changes in the weather and the climate also cause urticaria. Various internal diseases can be a sign of urticaria also. Internal malignancies can cause urticaria, but they come into the very, very late stage of urticaria as a line of indication or a symptom.
Right. So there are n number of things that can cause
Absolutely.
urticaria, basically. Okay. Doctor, is it an allergy? You have already said that it's associated with allergies, etc. So is it an
Yes.
allergy?
Yes, it is basically a skin allergy. Now,
Mhm.
skin allergy is a very common term to be used in particular. Urticaria more likely happens to be a term which is associated with different blood dyscariasis in the body. Ideally, what happens is our blood undergoes certain changes. There is a level of serum in the body which is known as serum IgE, which is an immunoglobulin. That happens to rise in patients suffering with urticaria. So that is the reason why there is an allergic reaction that happens into the skin after eating a particular item or probably getting exposed to a different temperature. Sometimes stress and anxiety can also cause urticaria.
Okay. I can imagine that, as you said, that, these are rashes, you will keep on itching them. So that way, anyways, it will cause a lot of stress because a patient who's having urticaria or this condition will be in tremendous stress or discomfort or frustration or irritation. But now you're also saying that stress and anxiety can actually lead to urticaria as
Can
well.
trigger
Please,
urticaria.
yes, please elaborate this a bit, doctor.
Ideally, what happens is stress and anxiety triggers certain hormones in our body. Basically, of the happy hormones in the body, ideally the dopamine and serotonin, right? So there are certain cells in the body that start to release antihistaminic properties or histamine-like properties like mast cells and other cells in the body. These tend to cause an irritation to the skin, which in turn gives the person a feeling of intense itching and intense discomfort, as if multiple needles are pricking into the skin. Sometimes it can be a very fearsome condition. People may start endlessly itching unless and until they take a certain medication. Now, the relief point in this urticaria is sometimes it may last for an hour or 2 hours, but sometimes it can also exceed for more than 24 hours and cause serious complications also.
So when you say serious complication, how serious those complications can?
Ideally, what can happen is basically patients can suffer serious amount of swellings on their eyelids, which may interfere with their vision. They can have serious amount of swelling around their lips and the esophageal tract, which may cause difficulty in swallowing different types of food or even speaking. There is also bronchodilation, which leads to a lot of breathing difficulties and swelling in the genitalia also. So it can end up into a serious condition wherein a patient may require hospitalization and immediate care.
How serious is urticaria or can urticaria be, doctor? Is it a serious disease in general?
Technically, acute urticaria, which happens over less than 2 weeks duration, is not a very serious condition and can be treated with very simple, very basic antihistamines like cetirizine, levocetirizine, which are the different drugs that most people are aware of.
Right.
But at times, this can be serious when the condition is chronic and exceeding for more than 6 to 12 months in a particular patient. It can complicate their daily lifestyle. Patient may be dependent on a medical help every single day, may have to pop a pill for their urticarial outbreaks every now and then. And also sometimes patients who are allergic in other forms also can develop this disease and may require hospitalization.
Okay. So can urticaria be life-threatening?
Absolutely. Urticaria in very, very serious and grave conditions can also be life-threatening. Like I mentioned, it can cause difficulty with breathing and different other complications. It can definitely be life-threatening and patients may require immediate care for the same.
Okay. So, doctor, you said that, there are two types of urticaria, acute or chronic. Acute is for, shorter period. Chronic is when it overlaps a certain amount of period. Now, in chronic urticaria hives, how will they go away? What is the treatment like, and will they go away forever?
Ideally, there are various modes of treatment for urticaria, which starts very basically from oral antihistaminic tablets, right? Now, antihistamines, like I said, are histamine depleting tablets which are there in the body. So histamine is a component which is found in our body, which leads to an upsurge in conditions of urticaria. So there are different medications which are available. Ideally, it should be managed with antihistaminic tablets, but then oral steroids as a second line of management can be used. There are other immunosuppressive drugs which are available like cyclosporine, methotrexate, and all these other components which are used. Certain injectables are also used for treating urticaria like immunoglobulins, which are now not as used as the other subjects. And injectable steroids are also available for the management of the same.
Okay. Initially, we said that urticaria is very common and almost everybody get it at least once in their lifetime. So, and now as we know that, there are basically two broader bifurcations that we can make. One is acute, one is chronic. Now, which part of the percentage of population fall into which category? I mean, mostly people have acute, so it's easy to treat them, or the number of patients in chronic urticaria is more?
Ideally, that is not a very fixed percentage that anybody can give. Ideally, a lot of patients who come with fresh history of urticaria are categorized into the acute stage, and there are certain patients who've been suffering with urticaria for years and may have not been diagnosed readily. So that is the reason why they fall into a different category. Now, on the basis of statistics, there are definitely newer cases coming up. So a large amount of population falls into the acute urticaria criteria. But also there is almost 45 to 48% category of patients who are suffering with at least chronic urticaria maximally.
Okay. And doctor, what are the potential complications of urticaria if left untreated?
Like I mentioned earlier as well, if left untreated, it can exceed to different parts of the body. If not treated at the right time, and if it does not settle within 24 to 48 hours, the patient may suffer with swelling around the lips, the genital areas, the internal organs can undergo swelling. Patient may have difficulty in breathing, difficulty in swallowing, difficulty in talking. Patient may get severe arrests of breathing, and the patient may ultimately succumb to death.
That sounds really scary and serious. So the point is, the bottom line is that we should not ignore the symptoms or whatever rashes etc. is coming on our skin. Now the thing is that as a layman, how do I know that okay, this is not a normal rash, this is urticaria? You have already told us the symptoms, how it looks like, but still for better understanding of me and our viewers, will you please explain it once more?
So urticaria basically will appear to be as red rashes. Now rashes will be a very generalized term to use. Basically, what you can understand with urticaria is sudden bouts of extreme itching and sudden areas undergoing swelling along with redness. Like the patch may not just appear red and circular, but it may also appear raised from the surrounding skin. Okay. In different parts of the body. There is another way to understand urticaria is when a person uses the nails to itch, or suppose there are a lot of Indian population who start using a comb or a hairbrush to start itching. In those cases, what really happens is the hair strands, or probably the strands of the comb that you're using, the brush bristles may cause the rashes on your hands while you scratch along as well. So you see red longitudinal lines in the direction of the scratching as well, which is also known as dermographism. So basically, if I want to identify a patient, what I can do is I can take the sharp object of a pen and try to scribble the name without using the ink in that particular pen, and I will see a raised demarcation of the patient's name on the forearm or any depicted area of the body.
Mm-hmm. So, for example, someone is having these symptoms, having urticaria, and he now knows that, okay, this may be urticaria. What he or she should do?
Ideally, the ideal diagnosis and visiting the right dermatologist is very, very important in the very first place. If you've already gone, because over the counter, I would first like to say that, avoiding over the counter medication. Because a lot of people tend to directly go to a medical store and try to buy a particular pill for the treatment. Sometimes they get the right kind of medication also without the correct diagnosis, because there is one tablet which treats a lot of different conditions. The best available medication can only be prescribed by a registered and certified dermatologist. So ideally, for the correct diagnosis, the patient or a client should visit a dermatologist first, find the root cause of the problem, identify the problem and correctly treat it, and also eradicate the root cause of the problem.
Right. It's important to diagnose the whole thing and understand what's causing urticaria in a particular person and then treat it as accordingly. Now, doctor, as you very well mentioned that there are people, it's allergy, right? And
Absolutely.
we know some anti-allergens, all of us know about it. And you said that over-the-counter medication can be harmful, it can be
Absolutely.
dangerous. Now, if people just go and buy those anti-allergens to, relieve them or they should, I mean, what should they do now if they are watching this session? Because it may hamper them, or in a long run, it may cause, difficulty or the end up worsening the condition.
Yes, absolutely. Ideally, when a person starts with any kind of medication, they need to have the right and proper prescription to taking the particular medication that they are taking. Like I mentioned, the first line of treatment for urticaria is to take oral antihistaminic tablets. Now, there are various categories to oral antihistamines, or let me put it as tablets which prevent itching. Now, they are of different types. Some tablets can cause sedation. I'm sure a lot of our viewers might have experienced tablets that are used to prevent itching, cause a lot of drowsiness or sleepiness. Now, that can create a problem at your workplace, for people who are driving to work, for people who ride bikes. It can be a very dangerous situation. So what medication is to be prescribed, which medicine is non-sedative, which medicine can cause sedation, identifying that as a problem is very, very important. Sometimes this can be very, very risky to the patient's life, and it can endanger others' life as well.
Right. So it's the bottom line is it's very important not to ignore your symptoms. Anyways, it will itch intensely. The itching will be so much that you won't be able to ignore it. But then don't try other things. Go and meet your dermatologist. That's very
Right.
important. Next, don't do self-medication. It can be really, really harmful. So please go and meet your dermatologist. That's really important. Doctor, one more thing. Many patients complain that hives or urticaria get worse during night. Is
Yeah.
this true?
Yeah, absolutely. They can worsen during the night time. There are various aspects of urticaria, and there are multiple types of urticaria. Certain urticarias are also called as contact urticarias, which can be an allergic reaction to a particular clothing material that you're wearing. So people who finish their day's work and suddenly go out at night after changing and taking a shower, suddenly start feeling an excessive amount of itching in their body, which is because the particular material of cloth that they were in contact with was not very suitable for their skin type. Also, secondly, there are certain hormones which is regulated naturally in our body, which is on the higher level during the daytime, approximately between 8 a.m. in the morning to 2 p.m. in the afternoon. And after 3 p.m. in the evening, they suddenly start to drop down. And at night time, they're at their least levels. So when these hormonal levels in our body drop down, the urticarial reaction also increases in time. So that could be very, very, very problematic. The second reason why people may experience urticaria at night time is also the kind of food that they've consumed just before bed. Every person who's had an urticarial attack should always understand and always notice what was the last meal that they consumed in the last 24 hours. Most commonly, any kinds of nuts, any kinds of seafood items, any clothing material, any particular seeds that they consumed, any kind of vegetables can cause urticaria. So they should make a note of what they've eaten. Sometimes even dairy products are very notoriously known for causing urticarial reactions.
Okay. Now, doctor, as we are talking of food items and food allergies, what happens? Most of the people know that they are allergic to certain things. Like if they are allergic to cashew nuts, if they are allergic to seafoods, if they are allergic to egg, they'll probably try to ignore and avoid those foods. But then there are people, for them maybe it's the first time they are having any allergy from any food items or allergy from any other things that you have already mentioned. What should they do? Because they don't know whether it's from the food that they have consumed, they don't know whether it's from the pollens or anything, any foreign body or etc. So what should they do?
Like we've mentioned, the various list of things which are already there, which we mentioned rightly, they should be eradicated from the diet. They should go on a 21-day fast from any kinds of nuts, any kind of seed vegetables, any kind of seafood items, and eliminate that from their daily diet, ideally, with the proper medication that a person can start taking.
I think we have lost Dr. Chaube, and he'll join us soon. But till then, yeah, we would like to just revise what we have understood from the session so far. So we were talking about urticaria, how it looks like. Of course, it's a rash, red in color, but then a little bit of swelling will also be there. And in case you scratch it with a pen or your nails or a comb, it will have the marks. So that's how you can understand whether the rash that you are having is urticaria or not. Another thing which is very important is to understand that in case you have urticaria or any other skin condition or allergy, you need to consult your dermatologist before it gets too late. So the sooner you go, the sooner you'll get, relief from the condition, and at least the doctor will know that what it is. It's important to diagnose the cause. It's important to go to the root of the cause and then try to eliminate them. Again, if you are allergic to certain food items or other things, that please try to avoid those things, skip those things from your meals for a certain time period. That's also important. And else you can make a chart where you can keep, writing in case you have this urticaria, that what you have eaten or consumed in past 24 hours. I think doctor is back with us.
Yeah.
Okay. So, doctor, we were talking about that, what dietary precautions we can take care of and some do's and don'ts for our patients of urticaria.
Yes, absolutely. Yeah, so ideally, what dietary precautions one can take is avoid any kind of cashew nuts, peanuts, and any kind of cereals in your diet. You need to avoid fruits and vegetables like brinjals. You need to avoid bottle gourd in your diet. Yeah, for people to better understand is basically other seafood items, especially the ones which are found in the forms of prawns and lobsters, should be avoided ideally. Dairy products, considering cheese, ghee, paneer, and milk, can also cause this, so they should be avoiding that. Tea can also sometimes trigger urticaria. That also needs to be avoided equally.
Right. Before we move forward, doctor, I would like to request you to, put your camera. I think you need to shift your camera. Yes. And if you can put it on a landscape mode, that will be more convenient. Otherwise, this is also fine. So, yeah. So we spoke about the dietary precautions or do's and don'ts for patients of urticaria. Many a times it also happens, doctor, like I know that people normally are allergic to brinjal, seafood, eggs, or whatever items we just discussed. Now, even if
Yes.
I don't know whether I'm allergic to them or not, but I'll make a blanket list and I'll say I won't eat these because I don't want to have urticaria or any allergy with these food items. Is this a good thing to do?
Yeah, absolutely. There are certain things that we can definitely eliminate from our diet. Now, as you rightly mentioned, when you're not aware of the things that you're basically allergic to, what you can do is basically there is an allergic test which is available in the laboratories that a person can opt for. But these things, these things ideally come in practice only once you've consulted your doctor and the doctor has advised them to you. You don't directly walk into a laboratory to get a certain test done, right? So there are tests which are available. You can definitely consult the known person for in order to get these tests done when you're unaware of various products that are available.
Mhm. As we just spoke a little before that, people say that their urticaria get worse during night. Another thing that people normally complain about is that they get very tired. Why that's so? Why people with urticaria get so tired or fatigued?
It has more to do with the mental disturbance that urticaria causes. There is no particular symptom of tiredness associated with urticaria or acute urticaria, actually. But tiredness or fatigue is more associated with the mental disturbance that the disease causes. The amount of constant itching, discomfort, the feeling of constantly wanting to itch various parts of the body. And especially when you're into a social community where there are a lot of people around you, it becomes all the more a taboo or a stigma to be wanting to scratching in front of a large amount of people, and that's what causes a lot of mental discomfort, stress, and anxiety, which leads to fatigue.
I can completely imagine the situation. A person who's continuously itching and who's, kind of avoiding socializing or going to public places because he or she knows that they'll go through a lot of embarrassment or awkward situation. So definitely it will increase the mental stress, etc. I'll pick one question before I go ahead with other questions. Ankita Mishra is asking, my husband has skin allergy urticaria for more than 6 months now. Took many treatments, but not fully cured. Again and again, he is getting these. Is it fully curable?
Absolutely. It is fully curable, but there are different lines of medication which are available for it. As a dermatologist or as a doctor in younger patients or slightly in very, very old patients also, the ideal treatment, the doctor may not want to keep the patient on immunosuppressive drugs for a very, very long period of time. So what a person can do is, like we said, dietary elimination is one of the things that one can do. Second thing that the person can do is certain basic antihistaminics can be made a part of a daily routine, that if a person knows that he gets a bout of it, keep an emergency medicine box ready with you at all times and just pop a very simple pill, which may not cause as many side effects as the other medications which are available in the market. And that could definitely keep you free from that distress.
Right. Doctor, one more thing. As you said, that urticaria is a skin allergy. Now, normally with allergies, especially with skin allergies, people have this thing that I'll get this allergy from him, or it is contagious. What's the truth with urticaria?
Urticaria is not a communicable disease. It does not spread to any kind of physical contact. It cannot spread through any kind of touch, not via saliva, not anything. It's a definition, is basically a different changes occurring in your bloodstream because of a contact allergen. An allergen which is present in your environment or in the food that you eat or the water that you consume can definitely lead to urticaria, but you will never get it from a partner or from any random person around through any source of contact.
Oh, that's a good thing that urticaria is not contagious, not at all contagious. Doctor, now in last 2.5 years, when we had what we call COVID era, people came up with the issue that COVID has caused hives on their face or hives or urticaria was like, a symptom that they are having COVID, etc. So these cases also came up in large quantity. What's that?
Yeah, absolutely. There was various large amount of medications were used during the COVID that we had been facing for the last 2.5 years. Patients who suffered, whether they were at home or whether they were hospitalized, were put under a lot of stress, a lot of medical stress, a lot of medications, and a lot of medicines in the entire COVID era was basically associated with immunosuppressive drugs or systemic steroids. So steroids, when they suddenly infuse the body with a large amount of steroids, and when that is suddenly removed after you are completely healed from your COVID, can definitely lead to urticaria or urticarial related issues because various parameters of your immunity have changed. Different changes take place in your bloodstream. The vaccines also have had a different reaction for different people. So yes, there have been a few cases post COVID wherein people have been suffering with urticaria, but the line of management still remains the same. It does not mean that just because a person suffered with COVID and then got urticaria means it is a more severe condition. The line of treatment and the condition remains the same.
Okay, Megha Sharma is here asking, sir, urticaria genetic होता है क्या?
नॉट नेसेसरीली, बिल्कुल जरूरी नहीं है कि ये अर्टिकेरिया जेनेटिक ही हो. ये आपको किसी भी समय पर किसी भी एज में हो सकता है, तो इसका जेनेटिक्स से बहुत ज्यादा ताल्लुक नहीं है.
Okay. Now, doctor, we would like to talk about the treatment options, though we have, spoke about it in bits and pieces. But now, what are the treatment options available? Plus, when a person who has, urticaria will go to a doctor, do he or she need to do some lab tests? So, are lab tests needed? And if why?
Yes, absolutely. But in starting in terms of diagnosis, how do you diagnose? Ideally, you require certain blood tests. Urticaria may also be associated with certain other conditions like thyroid disorders, any kind of other autoimmune diseases like diabetes mellitus, other kind of liver diseases, or any kind of kidney diseases. Sometimes person should also remember if he or she is already on any kind of medication, whether it is for diabetes, hypertension, tuberculosis, or other factors as well. So certain multivitamins can also cause urticaria. So these things should be kept in mind. The laboratory investigations depends on the patient's conditions, like we characterized earlier as acute and chronic. That tells the doctor whether the patient needs to be investigated. So a normal CBC count, that is a complete blood count, which gives you a right amount of idea of the red blood cells, the white blood cells, platelets, and your differential counts, which is your neutrophils, eosinophils, lymphocytes, which are different components of your white blood cells. Now, as we all know, white blood cells are basically soldiers of the body. They help to fight various diseases. So the white blood cells, the differential white blood cell count, tells us whether any kind of immune related problem is there in the particular patient. Second important test which can be done is the erythrocyte sedimentation rate. ESR is sometimes found to be raised in patients suffering with urticaria. We do a complete thyroid analysis also in these patients. Then we do a serum immunoglobulin test, which is IgE, the immunoglobulin E test. There is a specialized test available in the immunoglobulin E, but that comes into a more advanced form of the treatment, which may not be required in the very first line of management. So these are the three basic tests that a person may have to do when suffering with urticaria.
And then what's the line of treatment or the treatment options available?
Line of treatment is oral and topical medications both. Oral, which we consume orally, topical, which we apply on the body. Like, there are in topically, when we talk about various moisturizers that keep your body soothing, calamine lotions can be used, which are slightly cooler in application. Mild steroids can be applied on the body in areas where the urticarial reactions are present, like beclomethasone, betamethasone, mometazone are the different creams that you can apply on the body that can settle the urticarial reaction to a certain extent. Mainly, the first line of treatment has to be oral medication, where the person has to start with antihistaminic tablets. Whether, depending on the severity of the condition, a doctor decides whether they are supposed to be sedative or non-sedative variant of the medications to be given to the particular patient.
All right.
There are certain,
Yes. We have Praful Sharma, doctor, and his question is, can I use over-the-counter medication or do I need prescription?
You need a prescription ideally. Any individual should ideally go for a prescription. We should largely discourage medical stores to give out over-the-counter medications to patients when they are not aware of the right diagnosis. It can be life-threatening at times.
Right. So please avoid over-the-counter medication and go to your doctor and seek advice from there. Now, Kiran Chauhan is asking, how is acute urticaria characterized?
Acute urticaria, firstly, the history is basically very, very important. Acute urticaria can be an urticarial reaction starting from day one. Like today can be your first day of the reaction, or it could be less than 2 weeks in history. You never had it before. Today is the first day you got it, and it's been a week since you've been having it, or 2 weeks maximum. That is acute urticaria. Anything extending from beyond 2 to 4 weeks is known as chronic urticaria. Now, characterization in terms of how it would appear on the body, it could be small red raised papules or rashes on the body with small amount of swelling, and it can appear on any and every part of the body.
Okay. We have Shraddha Dave asking, sir, allergy lifetime tak reh sakti hai kya?
हाँ, अगर उनका निवारण या उनका ट्रीटमेंट सही समय पे ना किया जाए और जिस वजह से आपको एलर्जी हो रही है, अगर उसको फाइंड आउट ना किया जाए तो जरूर ये लाइफ लॉन्ग रह सकती है।
डॉक्टर, कई बार ये भी होता है, मान लीजिए अक्यूट आर्टिकेरिया नहीं, क्रॉनिक आर्टिकेरिया के पेशेंट है, वो डॉक्टर के पास गए, उन्होंने उनको ट्रीटमेंट बताया, उन्होंने ट्रीटमेंट लिया, उससे आराम भी मिला, फिर वो खुद से ही मेडिसिन लेना बंद कर देते हैं, ट्रीटमेंट बंद कर देते हैं। मान लीजिए फिर थोड़े टाइम बाद उनको फिर से सिम्टम्स दिखे, तो वो प्रिस्क्रिप्शन उनके पास है ही, वो फिर से वही दवाई लेंगे, शुरू कर देंगे खुद से, बिना डॉक्टर से बात किए, और फिर यही सर्कल चलता रहता है। ये कितना सही है करना?
अगेन मैं कहूंगा कि इसके अंदर सही और गलत से ज्यादा हर बार आपको इसकी कारण को ढूंढना बहुत ज्यादा जरूरी है। हर बार आपको जो ट्रिगर हो सकता है, जैसे हर बार हमें सर्दी होती है, लेकिन हर बार सर्दी की सेम दवा काम नहीं कर पाती है। वो अगर 2 से 3 दिन में ठीक होनी है तो वो 2 से 3 दिन में ही ठीक होती है, क्योंकि हर बार सर्दी होने का कारण कुछ और होता है। वैसे ही अर्टिकेरिया के जो ट्रिगर्स होते हैं वो हर बार किसी और कारण की वजह से आपको हो सकते हैं। पिछली बार हो सकता है कि आपने ऐसा कुछ खा लिया जिस वजह से ये रिएक्शन आपको हुआ। इस बार हो सकता है कि आपका मेंटल स्ट्रेस कहीं पे बढ़ गया जिस वजह से आपका इसका रिएक्शन हुआ। तो हर बार शायद सेम दवाई आपको टेम्पररी रिलीफ तो दे देगी, बट उसका रूट कॉज सॉल्व नहीं होगा।
राइट। तो पूरा जो ट्रीटमेंट का कोर्स है उसे पूरा करना भी बहुत जरूरी है, वरना फिर ये हो सकता है कि हमने उसके रूट
जी
कॉज
बिल्कुल
को।
बिल्कुल।
राइट।
ट्रीटमेंट का कोर्स पूरा करना जरूरी है, और आपको अर्टिकेरिया का मैं आपको बता दूं, बहुत जल्दी इसका हल मिलना इज नॉट वेरी इजी। इट इज अ चैलेंजिंग कंडीशन फॉर अस as dermatologists also to provide relief to the patients, and that's the reason why a lot of patients discontinue treatment, क्योंकि काफी लंबे समय तक दवाइयां खाने के बावजूद भी उन्हें आराम नहीं मिल पाता है। तो इसलिए जरूरी ये है कि वो कंसल्ट करें और आगे मेडिकेशंस के दूसरे ऑप्शंस क्या हैं उनके ऊपर फोकस करें।
हम्म। कई बार ये भी होता है, खासकर जब स्किन एलर्जी किसी भी तरह की हो, वो अर्टिकेरिया हो ना हो, तो लोग सबसे पहले तो देखते हैं कि शायद ये खुद से ठीक हो जाएगा। नहीं हो तो फिर वो उस पे कुछ होम रेमेडी करने की कोशिश करते हैं। किचन हमारा सबसे इजी एक होम रेमेडी का स्टेशन होता है, जहां हम जाते हैं, कुछ हमको दादी नानी के नुस्खे हम उस पे आजमाते हैं। एलोवेरा भी बहुत पॉपुलर है। कुछ भी होता है तो हमको लगता है एलोवेरा जेल अगर हम लगा लेंगे, आजकल सबके घरों में होने लगा है, तो एलोवेरा से जेल निकाल के लगा लेते हैं। अगर ऐसा कोई करता है आर्टिकेरिया के केस में, तो क्या उन आर्टिकेरिया को रिलीव करता है या फिर उसे और बढ़ा भी सकता है?
अब जैसा कि आपने पूछा, जब तक इंसान को ये सब चीजें करने से टेम्पररी रिलीफ मिले, तब तक तो वो बिल्कुल भी अपने घर से बाहर ना निकल के इसका इलाज खुद घर पे कर सकते हैं या कर लेंगे। लेकिन कई बार ऐसा हो जाता है कि ये चीज आपके बर्दाश्त के इतनी बाहर हो जाती है कि आपको मेडिकल हेल्प लेनी ही पड़ती है। And that is when the patients come to us also, to a skin specialist, and not just urticaria। ये मैं कहना चाहूंगा कि हर स्किन या हेयर रिलेटेड बीमारी जो होती है, हमें लगता है कि शायद स्किन पे है तो ये बहुत ज्यादा कंसर्निंग नहीं है, अनलेस एंड अनटिल ये कॉस्मेटिक कंसर्न हो, जिसमें चेहरे पे कोई चीज दिख रही है और वो आपको दिखने में खराब लग रही हो, या फिर कोई ऐसी प्रॉब्लम आपको हो जाए जिससे आपको निवारण नहीं मिल पा रहा है। तो जब तक आप उस चीज का घर में इलाज करते रहेंगे, हो सकता है कि आपको इससे टेम्पररी रिलीफ मिल जाए, लेकिन वो परमानेंट रिलीफ नहीं होता कई बार। तो उस समय आप मेडिकल हेल्प लेने के लिए जाते हो, और कई बार घरेलू नुस्खे भी हम पे बैकफायर कर सकते हैं। आई एम नॉट सेइंग ये जरूर करते हैं, बिल्कुल भी मेरा ये कहना नहीं है, बट ये कई बार हम पे बैकफायर कर सकते हैं। कई बार कुछ कंडीशंस होते हैं जहां पर लोग हल्दी का लेप लगा लेते हैं, या जैसा कि आपने कहा कि एलोवेरा जेल लगा लेते हैं, तो कई बार वो एक दूसरे रिएक्शन को जन्म दे सकता है एट द सेम टाइम।
एंड हमें नहीं पता कि हमें किस चीज से एलर्जी
जी
है, तो हो
जी
सकता है कि हम जो अप्लाई कर रहे हैं उससे भी हमें एलर्जी हो जाए, या वो उसे और ज्यादा इरिटेट कर दे, तो जो
बिल्कुल,
प्रॉब्लम है वो सही होने की बजाय वो ज्यादा बढ़ जाए। तो
और ज्यादा
बेटर है
वर्स हो सकती है।
कि हम डॉक्टर की सलाह इसमें जरूर लें। रचना शिंदे हमारे साथ जुड़ी हैं, पूछ रही हैं, सर अभी बारिश का मौसम शुरू हो चुका है और इस समय बॉडी में रेडनेस और स्वेलिंग बढ़ जाती है, इसके लिए क्या सोल्यूशन है?
सबसे पहले तो बारिश के समय में ये होता है कि हम बारिश के पानी में भीग जाते हैं ट्रैवल करते समय। वो चाहे थोड़े से छींटे हो पानी के, या रास्ते पे उड़ने वाला पानी हो जो ऑलरेडी कंटामिनेटेड होता है। तो आइडियली आप अपने घर या अपने ऑफिस जहां पर भी पहुंचे, सबसे पहले ये कोशिश करें कि अपने हाथों को पैरों को अच्छे से धो करके इस्तेमाल आगे बढ़े। दूसरी चीजें ये होती है कि आप हमेशा अपने साथ में अपने कपड़े चेंज करने के टाइम सबसे पहले एक नॉर्मल पानी से शावर लें। उसके बाद अगर रेडनेस स्वेलिंग आपको फिर भी कंटिन्यूअस लगती है, तो देखिए कि आपके डाइट के अंदर क्या चीजें हैं जो आप एलिमिनेट कर सकती हैं जिस वजह से ये रेडनेस या स्वेलिंग आ रही है। दूसरी चीज, जैसा मैंने आपको कहा कि आप कुछ दवाइयां स्टार्ट कर सकते हैं, जो कि आपके डॉक्टर्स आपको बता सकते हैं अपनी सही सलाह से कि वो क्या चालू करनी चाहिए आपको।
राइट। डॉक्टर, चूंकि बारिश की मौसम की बात चल रही है, तो कई बार समर्स में भी रेडनेस या जो भी आपने सिम्टम्स अर्टिकेरिया के बताए उस तरह से वो सिम्टम्स देखने को मिलते हैं। कपड़ों के बारे में भी आपने बताया कि वो भी एक रीजन हो सकता है, तो क्या मौसम, वेदर, एक्सेसिव हीट, ये भी अर्टिकेरिया की वजह होती है?
जी, ये बिल्कुल डेफिनेटली, ये डिफरेंट टाइप्स ऑफ अर्टिकेरिया होते हैं। जैसे कि अगर हम इसमें और डिटेल में जाएं, तो सनलाइट के वजह से भी अर्टिकेरिया होती है, बहुत ज्यादा ठंडी चीज या बहुत ज्यादा गर्म चीजों से भी अर्टिकेरिया हो सकता है। अगर आपको कहीं पे आप गिर गए हो, जमीन से आपको चोट लग गई है, तो प्रेशर से आपको अर्टिकेरिया हो सकता है। तो इसके बहुत सारे ट्रिगर्स होते हैं बेसिकली।
Right. And doctor, as now we are moving towards the conclusion part of this session, any takeaway message, anything that you would like to share with our viewers?
Absolutely. It is very important कि आप लोग अवेयर रहें कि ये चीज किस वजह से हो रही है। सबसे पहले किसी भी चीज का रूट कॉज जानना बहुत जरूरी है, जिससे कि हमें पता चल सकता है कि हमें अपनी लाइफ से क्या चीज को एलिमिनेट करना है, rather than the jumping to a conclusion or just popping any medicine which is available at your medical store or at homes for that matter. And when you're taking consultation, it is rather better that you ask your doctor instead of asking a friend or a relative about a problem which a person may have suffered with the same condition, but because of a different reason. So sometimes an X medicine which worked on your friend or the relative may not work on you. So it is very, very important to take the right consultation in those matters.
Right. And as doctor have already mentioned that, urticaria can be caused by n number of things. So you don't know what's your cause, what's causing urticaria in you. So it's always good. It's always better to consult your dermatologist. Thank you so very much, Dr. Shikhhar Chaube, for your valuable time, sir. It has been a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they now know at least that, instead of self-medication, it's always better to approach a nearby dermatologist. Thank you so much.
Thank you so much. Thank you.
So we really look forward for many more such sessions in coming times with you for our viewers. Thank you. And thank you, viewers, for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Goodbye.
Thank you so much. Thank you.